It's your first time, welcome. So nice to have you here. And all right, now we're live on both platforms. So nice to have you here. And if you've been here for the 100th time, I want to welcome you back. I hope that you'll say hello. Please leave me a comment and let me know if you're joining our live today and where you're from, and if you have any questions as well. And especially if you're a mom dealing with chronic back pain or neck pain due to bulging discs or herniated discs, and you're being told that you need surgery or injections and you just don't want to do that, and you are looking for another option, you are at the right place, because that's what we are all about. And so today, what I want to do is I want to show you how to stretch your low back. It's one of the most important things that you can do while you're at home if you're not doing anything else to really help improve how you feel in your low back. And so we're going to show you that. So we're going to talk about how does back pain, where does it come from, and what is its cause, so you can understand a little bit about that. And I'm going to show you a little bit of part of my journey. So let's get on with it. So what causes back pain? Well, there's two major things that cause back pain. Number one is the spinal disc. That is the number one generator of low back pain. And number two is the facet joint. So, a lot of people ask, well, how do you know much about this? Well, I've been in practice for 25 years doing that. But, I hate sharing this, but I want to share it with you. I also injured my back. This is my low back about 4 years ago after a bad accident at the skateboard park with my kids. And yes, I had to rehabilitate that. And the only time that usually you ever see someone's back that is all black and blue like that is actually when they fracture their back. I was incredibly scared that that's what happened to me, and the gods were looking out for me, and somehow or another did not fracture my back with that, but I had to learn how to rehab it, and let me tell you, and I messed it up really well. So I talk to you from personal experience, and I've been down a similar road, of course not the road that you have walked, but probably one somewhat parallel with that, with chronic back pain and having to get back to life, and then having to get to be the dad that I wanted to be and being active again. And I want to help you do that too. And so what we're going to do is we want to teach you how to stretch your low back. Unfortunately, the video that I have all hooked up here didn't want to play, but we'll put a link in the description here and you can go to my YouTube channel and watch it. So let's talk about just these two causes of back pain really quick. So number one is the facet joint. In fact, it's actually number two. So the second cause of back pain is what's called the facet joint. And the facet joint is this area that you see I have circled right here. It's made up of two parts. You have this upper part and this lower part. So if we look at a model and you want to see that, you have this piece and this piece, which is on this bone, and then you have that part and that part, okay? Superior articular processes, inferior articular processes, and what they do is they allow you to have glide like this. So when you go and you take a shower and you bend forward to get some soap, or you do a stretch, or you go to pick up your child, anything like that, this is where the majority of that movement is happening, is in these facet joints. And the facet joints have a lot of pain receptors around them, and they also have pretty decent blood supply to them as well, and they can get inflamed and really irritated, but that's the number two cause of back pain. The number one cause of back pain is the disc itself. Sorry, I wasn't in focus there. There we go. And so this structure right here is the intervertebral disc, and it's made up of two parts. The annulus fibrosus, which are these outer rings that you see coming around this whole area, and then this inner part, this inner jelly that you see right through here called the nucleus pulposus. Just so you know, we want your annular fibers to look like this, where I've circled. You can see all these bands that go across are all nice and strong. They're all intact. We want that to happen all the way around your disc, all right? Not like what you see right here, where there's been damage to this articular process, or annular fibers, I'm sorry, and the jelly is pushing out like a jelly donut onto that nerve right there and causing a lot of pain. The beautiful part is that if you do these stretches will help you either if you have disc pain or facet-based pain. So that's one of the nice wins about it. So I had put up a video to show you how to do these stretches, and for some reason, even though it plays on my main computer, it's not getting transferred over for the presentation. So I'm going to walk you through it. and verbally. And then you can also go on to Dr. Sean McWilliams, DC, on my YouTube channel, and you'll be able to find this. Yeah, I know, Marisa, it does look pretty awful. It was pretty awful, to be quite honest with you. When it happened, I knew I was in trouble immediately. Immediately, it was not my best day at all, nor actually my best 2 months after that. It took a lot to get it back, but we did a great job, and I get to share that with you. So it's important to be able to, I think doctors should have to experience things like that so they can actually know what their patients are going through as well. It's really hard to help guide somebody if you haven't walked in those shoes. But let me tell you, you can really connect with someone and understand what they're going through emotionally and physically and mentally, and be that anchor for them, which is what I really try to do for everybody here that's part of our community, to be an anchor for them and let them know that I have also messed my back up really bad and got it back naturally without surgery, and you can do it too, in probably 85+% of the cases. So this video, if you go watch it, is going to talk about a couple things. So I'll just kind of keep it brief because the video will sum it all up for you. I'm sorry I couldn't get this to play today. You're going to need some sort of strap. There's stretching straps out there, so if you're into yoga and all that stuff, there's probably a good chance you might have a stretching strap. A stretching strap is a strap that does not stretch. Okay, there's the link. Oh, thanks, Marisa. That was awesome of you. So, does not stretch. You can use a piece of rope. You can use a stretching strap. You can use the thing that holds your robe on. Those work really good. It's just something that's going to go around your foot, and you're going to be able to hold it with your hands. So the first stretch that you're going to do, you're going to lie on your back to do this, is we're going to be putting it on your foot, and you're going to be stretching your leg straight up like this. And the key is, and I explain all this in the video, is that you don't want to bend your knee. If you start to bend your knee, it's called active insufficiency. We actually cheat ourselves in the stretch if we bend the joint. So you want to keep the knee totally straight and just lift up until you start to feel some resistance. A good hurt is okay, but no pain, because pain is going to create inflammation, okay? You're going to hold that first one up for 30 seconds. Then you're going to drop it down. You're going to let your leg come out. And then you're going to start to lift that up. You're going to stretch that for 30 seconds, bring it down, bring it all the way across you, bring it up, stretch that for 30 seconds, and then bring it down. And then you got to flip onto your side. And on the side, you're going to be pulling your leg and knee back up from behind. And the video will show you that really well. And that's going to stretch your quadricep. Why stretch the quad? I'm glad you asked. That's a great question. Well, was a really big study done with almost 10,000 participants with chronic low back pain, and they had them stretch their hamstrings, the muscles in the back of the leg, and also their quads. When they did their hamstrings, some people got some small changes in their improvement in how they felt, but when they did their quads, it was a dramatic improvement in how they felt. You have to stretch the quadriceps when you're having chronic low back pain. The reason is because it pulls the pelvis and rotates it forward, and when that happens, it typically increases the curvature of the low back, and it jams the back of the joints like that when we have tight quads. And unfortunately, this is where all the nerve branches come out, is in the back, not in the front. And so we want to make sure that that's not happening. And to help that, stretching the quads helps open that up for you. Okay, so we got to make sure that we do that. There's a link. Thanks so much, Marisa, to get you to the YouTube link for that course. It takes about 5-6 minutes to do. And patients always ask me, what would you recommend, how often? The perfect recipe, if you really want to start feeling better fast, is you want to do these stretches before you go to bed, and then you also want to do them in the morning when you get up. Okay? And if you do that, you're going to notice the really big difference. To do the stretches really well, to do them 3 sides on each side, takes about 11 and 12 minutes, just so you know. Okay? So make sure you plan that and ask for help and at home to have that support, so that you can go and stretch and take care of yourself, okay? That's really important to ask for. Please don't try to do this alone. It's really tough trying to be super mom and while you're suffering silently, right? So yes, so go take a look at that. I think you're gonna really like that. Those are the top stretches that I've prescribed to my patients over the last 25 years, and they consistently work well for almost everybody. So, and they're my go-to stretches as well. So I hope you really will enjoy those. I think you will, and I think it'll get you to the next level. And hey, and if you're suffering with chronic back pain and you're a mom and you don't know which direction to go, and they're telling you that you need surgery for your bulging or herniated disc, or injections, and you're looking for a natural approach to managing your back pain without having to have surgery and those drugs, set an appointment up so we can chat. You can go to booking.drshawnmcwilliams.com. That's booking.drshawnmcwilliams.com. You can see my calendar for consultations. You can pick a day and a time that works best for you. You'll fill out a form and let me know about your back so that we can have a real conversation. And I guarantee at the end of the 15 to 20 minutes when we're done conversation, you're going to feel a lot more empowered and a lot more enlightened. And if that's something that perhaps we created to help you that you can do from home, we'll let you know that. And if it's not, and I got to help you get to someone else, I want to help you do that as well. All right, so please take advantage of it. It's normally $197 to set up that time with me, and I'm doing it complimentary right now just because I love you and I want you to feel good. So I hope you'll take advantage of that before I start charging again, okay? So booking.drshawnmcwilliams.com. I'll get that out of my mouth. And if you need anything else before that, you can DM me on Instagram or Facebook, and I'd be happy to help you. So it's great having everybody here. Thanks again for always joining our lives, and we will see you next Wednesday. And Marisa, thanks so much for putting up all the links. Greatly appreciate you doing that. You're the best. Yes, that's the link, Supermoms. If you got questions, if you're looking for other alternatives, you might not even know there are other alternatives. And let me tell you, I've had so many people come and talk to me and say, I've done everything. No, you haven't. Most people have never done spinal decompression. They really don't know much about it. And that's actually like the top tool for managing chronic back pain, bulging disc and herniated disc. And it works extremely well. And there's a lot of research behind it. So I just want you to know that, okay? So if you haven't done that, you haven't done anything. So set up a call with me. Let's chat and let's see if we can get you some help, okay? And thanks. All right, happy Wednesday, everyone. I love and appreciate you. Thanks for being here, and I'll see you next week. And hopefully I get to see some of you guys on calls so we can help you start feeling better now. All right. See you until next time.